Entrevista com Dr. Dallas Smith, epidemiologista que atua no ramo de doenças micóticas do Centro de Controle e Prevenção de Doenças dos Estados Unidos. Como a esporotricose felina mudou o perfil epidemiológico e os grupos de risco da doença ao longo do tempo.
In the past, we've normally thought of Esporotricosis kind of really being involved with people who do agricultural activities, who work outside. It's also known as the rose gardener's disease. But because of this new species, Sporothrix brasiliensis, we are seeing other demographics become at higher risk. For example, now we are seeing veterinarians at higher risk because of the zoonotic transmission and the risk of having a cat who's infected scratch or bite a veterinarian. At the same time, we're seeing people who take care of cats, whether that's an owner or someone in the community who take care of cats, become higher risk for sporotricosis. And so we have to think about how we identify and diagnose and treat patients as we see a shift in the demographics who are affected based on this new zoonotic transmission route.
Quais cuidados de proteção os tutores devem adotar e como ocorre a transmissão da esporotricose pelos gatos?
Owners of cats or other animals who may have Sporothrix brasiliensis should be wearing gloves, should be wearing long sleeves, and really trying to prevent any bites or scratches from the infected animals that could transmit the disease to the owner. I also want to mention that we've also seen Sporothrix brasiliensis spread by respiratory droplets. For example, when an infected cat sneezes and it gets into maybe an owner's eyes or a veterinarian's eyes and causes ocular sporotricosis. And so that's also something that we should be aware of. Bottom line is that patients should be aware of what sporotricosis looks like so that we can get it diagnosed early and treated early in the owner if transmission does occur. And so these are some things we should be looking out for and telling owners of these cats so that we make sure we can prevent transmission, but if transmission happens, that we can get them in early so that we can prevent severe disease.
Quais são as principais estratégias de saúde pública e manejo para controlar a propagação do Sporothrix brasiliensis em áreas endêmicas?
The best management strategies for areas or region experiencing zoonotic spread of Sporothrix brasiliensis really starts with awareness and diagnosis. We need to make sure that veterinarians and human clinicians are aware of this disease, of this new species, so that we can catch it early. But once it is identified, especially in cat populations, spay and neuter campaigns are really critical to control the spread and transmission of Sporothrix brasiliensis, because we often see male cats be very aggressive and get into fights with other cats and spread the disease. And so spay and neuter campaigns can help alleviate some of those, alleviate some of that transmission. And so really the basis of how we address outbreaks and epidemics of S. brasiliensis starts with a One Health approach. We need clinicians working with veterinarians, working with public health, working with nurses, working with the whole body of professionals in an area to really approach S. brasiliensis as a One Health disease.